Hello, I'm Elizabeth Safranco Adams. I'm the mobile clinic manager.
Hello, I'm Tina Clark. I'm the family nurse practitioner and also a dual master's exercise physiologist.
Hi, I'm Karen Wilmot. I am the certified medical assistant.
Hi, I'm Ashley Baum. I'm family nurse practitioner.
Hi, I'm Vera Smith, clerk, bus driver.
Welcome to our mobile clinic. I'm going to take you inside and show you our brand new renovated bus. When you first enter, this is where we would bring patients in right here. Right now during COVID, we're seeing everybody outside, but as soon as this pandemic ends, we'll be bringing them back in here. So we greet them, we meet them, bring them in here, and our clerk driver will sit over here, or our medical assistant, and they register the patient. We have our charts, they have clipboards already for them, and they just go ahead and start registering them and getting some health history. For our personal use down here to bring our lunches, and we have a coffee machine. Thank you to Ashley for that. And I would like to point this out. This whole renovation is Johns Island Foundation, and we so appreciate that. Back here is our exam room. This is where the nurse practitioner sees the patients when they do come on the clinic. We have our scale. We have all of our equipment over here. We can do urine testing, cholesterol testing, blood sugar testing, and hemoglobin. We do hemoglobin also. And we register, or we have amazing charts, our medical records in the computer, and that's where we put our records. And here's our medical refrigerator that we monitor on a daily basis. And we keep the flu shots and also the Tdap. We can do Tdaps and flu shots, and actually PPDs we do for a lot of the other agencies. Our eye charts. And the driver's area.
Thank you and see you soon.
In the heart of Indian River County's healthcare sector lies a peaceful oasis known as the VNA Hospice House. The Hospice House was founded to offer community members a place to receive compassionate end-of-life care when they can no longer be cared for at home. Through the generosity of donors and philanthropists, the Hospice House opened its doors in 2000 and continues to serve as the county's only hospice facility. Although a state-of-the-art medical facility, the Hospice House fosters more of a home-like environment for patients, families, and visitors. Every patient has a private suite equipped with space for visitors, a TV, and screened-in patio, allowing patients to enjoy the outdoors from their beds. In each private room, patients have what they need at their fingertips. Every room has updated technology too, so patients and visitors can order food or beverages to be delivered from the ease of a tablet in each room. The VNA Hospice House employs a private chef who creates individualized meals for each patient. Family members and loved ones can also enjoy comforting refreshments or hot beverages during their visit. Because the VNA Hospice House is a place where loved ones come to gather, we want every person who walks through our doors to feel welcomed and cared for. Seating areas and common rooms are available to patients, families, and visitors to gather or meet with counselors. The living room even boasts a grand piano for peaceful music to circulate through the house. In the smaller rooms, families can use the spaces for private moments or to meet with staff. Nurses provide around-the-clock care for residents, but the VNA Hospice House is much more than a place to receive compassionate end-of-life care. VNA believes in investing in programs that elevate patient care. And since hospice includes emotional, physical, and spiritual care, VNA offers chaplain services, bereavement counseling, music therapy, and pet therapy for patients and families. The outside of the Hospice House is just as peaceful and serene as its interior. The surrounding area has walking paths and sitting areas to enjoy with patients and families. For quiet meditation and reflection, A Place for Remembering is a memorial area where loved ones can be celebrated with a message of love engraved and displayed on a granite plaque. Each plaque is a gift that preserves the comforting nature of the Hospice House and ensures that this important resource will be available for future patients in need of compassionate end-of-life care.
Music therapy at the VNA has been around since 2015 when the program was founded. But the music therapy profession began gaining ground after World War I and II, with the first university program established around 1950. So what is music therapy, and why is it such an integral program at the VNA? First and foremost, music therapists are credentialed professionals who have completed an approved academic program, as well as over 1,000 hours of supervised clinical training, and have passed a national board certification exam. Music therapists are trained professionals to provide musical interventions to address the clinical needs of patients and clients. Music therapy at the VNA serves in every service line, including hospice, home health, community health and wellness, and private care. Our music therapists address everything from anxiety and depression, to gait training and speech recovery, to pain management and dealing with grief.
In hospice, we serve as members of the interdisciplinary team, offering unique perspectives on the care and well-being of our patients. When a team member submits a referral for music therapy, we reach out to the family and patient to begin care. Sometimes we have many months with our patients, learning the songs they love from their young adult years, building legacy projects to lead their families, writing songs, and playing instruments together. Other times, we provide support to patients who are actively dying, using musical interventions to help manage pain, regulate breathing, or provide comforting music to help the patient transition into the next life.
In home health, music therapy has a rehabilitative focus compared to the primarily symptom management approach in hospice. In home health, patients are often learning to manage their conditions, whether those are short-term, such as recovery from a fall or surgery, or long-term, like learning to cope with Parkinson's or the after effects of a stroke.
The music therapist uses techniques like neurological music therapy, which often focuses on the strong rhythmic elements of music to train the rhythmic elements in the body, like walking or speaking. The music therapist may also use interventions like playing various instruments to engage and strengthen motor functions, or singing to help employ deep breathing to regulate anxiety or a pulmonary condition like COPD.
Music therapy in private care is not differentiated by its approach or clientele, but rather by the condition that the clients are paying for music therapy directly, rather than receiving it through their service line. In home health and hospice, music therapy is free to the patient as long as they are on service with the VNA, since the VNA covers the music therapy costs. In private care, the patient is electing to pay for music therapy themselves, regardless of their condition or other health needs.
The final aspect of music therapy at the VNA is the Community Music Therapy Program. Founded in October of 2022 and made possible in part by funding from the Indian River Hospital District, the Community Music Therapy Program offers music therapy to Indian River residents outside of the VNA. Through partnerships with local organizations, the Community Music Therapy Program seeks to reach the marginalized and disempowered people who may be at risk for various physical or mental health complications due to their social circumstances or comorbid conditions that may worsen the other. This program primarily provides group music therapy sessions. We currently partner with 5 distinct organizations in the community, but the program is growing every day. The goal of these groups is to address mental and emotional health and provide musical coping skills and empowerment to manage their own health. The music therapist focuses on group cohesion to support one another, drum circles, songwriting, and musical exploration, allowing each client to grow individually as well as in the context of the group.
Music therapy is a unique and growing profession that employs safe, non-invasive techniques to help clients and patients in all stages of life to survive and thrive. The VNA is proud to offer music therapy to all its patients, as well as to the community, and stands behind its importance, both without and within the company. If you or someone you know could benefit from music therapy, please call the VNA at the number below or seek out one of our liaisons. Music therapy is honored to serve the patients of the VNA, collaborating as a team to provide excellent care to patients and families with integrity, compassion, knowledge, and love, so that patients experience optimal quality of life